Hi, I'm Tom Haney, and in this presentation I'm going to try to give you information that may help you to stay fit and healthy and avoid injury. Now before we get underway, I'd like to tell you that for credit from the LMHF Wellness Program Part 2, you must watch the video in its entirety, watch to the end, and then make a comment on each video with your name. Once confirmed by LMHF that you have watched the video in its entirety, your comments and name will be promptly removed. Thank you and enjoy. Today's presentation is about self-care. It's the self-care essentials actually for men. This is what we need to know to take care of ourselves. So it's going to cover a lot of ground, but I want you to at least be aware that we're going to talk about things that are directly related to men. Now, even if you're not a male, and you may have men in your life that you'd like to also have some awareness for or help out, this might be information for you as well. I've got to start by telling you that because many of us, guys, tend not to be as focused on our own well-being as we should be, that this process can certainly be confusing. I know that. There's a lot of information out there, and now that we have access to the internet, it makes us more confused. But the reality is you're not alone in this process. Your employer and your healthcare providers try to provide you information that will help you in making good decisions. Your insurance company, and of course your family, and you. All of these work together to try to protect you and your health as time goes on. So let's see if we can't get into this a little bit further. So we need to start with understanding that the leading causes of death for males in this country are heart disease, cancer, and unintentional injuries. Heart disease is the #1 killer of both men and women, so we'll cover that for sure. And cancer we'll talk about, but I want to kind of jump forward to the unintentional injuries because this is where the death risks are very different from those of women. So we want to talk here about accidental injuries, and they are usually the result of unsafe behaviors. Somebody, and usually us, does something dumb, unsafe, and the consequence is that we become injured. So this is kind of the flow chart. I'll just use this quickly. Is that when you're in a certain state of mind or action, like rushing or frustration or fatigue or simply complacency, your mind and your eye are not on the task that you're doing, and that's where the risk arises. When those occur, we start to see a higher rate of near misses, accidents, and injuries. So being aware, keeping your mind and your eye and your attention on the work that you're doing will help to minimize the risk of accidental injuries. But let's talk about the other ones. Now I should mention to you that we estimate that about 75% of our healthcare costs in this country are the result of chronic diseases. And about 70% of chronic diseases are avoidable. But what do I mean by chronic diseases? Well, as we mentioned, the leading causes of death among men and women is heart disease, cancer, diabetes. These are chronic diseases that last for a long time and affect our well-being and require a lot of attention and care for long periods of time. Well, what does all that have to do with me and us? It's this, is that what we know is that unhealthy habits account for most of the chronic diseases. That means not only are these avoidable by some medical interventions, they're avoidable by what we choose to do. And this is the list that has been pretty clearly established for ways to avoid these chronic diseases. They are the result of lack of physical activity, overeating, poor diet, tobacco use, excess alcohol use, and unmanaged stress. Let's see if we can cover these in some fashion to give you some hints. First of all, the goal of this whole presentation is to give you greater knowledge. I want you to understand what you can do to take care of you, but I also want to help you to navigate the healthcare system, make good healthcare decisions, and of course to really modify or improve your lifestyle behaviors. Start with overweight and obesity. It is certainly one of the risk factors for heart disease and certain kinds of cancer, and it's considered the second biggest driver of healthcare costs in this country. Now, overweight and obesity are a problem, there's no doubt. This slide was really designed to show you how it has progressed in blocks of 10 years. From 1900 to 2000 to 2010, there has been a dramatic increase in the amount and the prevalence of overweight and obesity in this country. This slide will kind of give you an idea of just how greatly it's changed from having a country in 1990 that was mostly under 30 or under 20% of people who are obese to now, or in 2010, we were up to the point where most of the country is between 25 and 30% of the population. That's 1 in 3 or 1 in 4 people who are obese. It's a major concern for us, and it is modifiable. We can change that to some degree. What are the consequences of obesity? Well, I mentioned before, it does increase your risk of heart disease, certain kinds of cancer, but also high blood pressure, sleep apnea, which we'll talk about, diabetes, and even joint problems. We certainly have more hip and knee replacements at this stage than we ever had in this country, and some of that is because we're simply carrying too much weight. It is a consequence of overeating and poor diet. I hope you don't mind that little picture in there, but we are what we eat to some degree. Understand, we are made up of what we were born with, what we acquire over the course of our lives, and the food that we consume. And so let's see if we can understand some of the ways to reduce our risk through our consumption of food. These are some of the obvious things that you should be thinking about and doing to try to reduce your risk through dietary intervention. First of all, reducing portion sizes. We are certainly in a country where large portions are considered a great value. Well, you know what? It isn't a great value if it causes you to develop heart disease or cancer. You've got to reduce the portion sizes. You know what? If the portions are too large, ask for a takeout bag, a container, take it home and have the rest of the meal tomorrow. Try to eat more fruits and vegetables. We are designed to consume fruits and vegetables. That's what we were designed to consume, because most of the necessary nutrients that we need to survive and thrive are readily available to us through the consumption of fruits and vegetables. Phytochemicals, vitamins, minerals, antioxidants, they are there and present in fruits and vegetables. We need to consume them. Choosing lean sources of protein. What does that mean? Well, this country is kind of focused on protein, there is no doubt. And we even have a system where beef is judged based on the amount of fat. Prime beef, and the grades are varied, but the idea is that what you should be looking for is lean protein. Low fat meat, low fat or no fat dairy, all of those kinds of things should be thought about in terms of what you consume and how you prepare your meals. Consuming more fiber, well, that basically for most of us means grains and certain vegetables. Fiber helps to lower cholesterol, good one for us. It also helps us to stay regular, so it is important to try to consume whole grains. That's really the key. Not the refined grains that we get in most of our baked goods, but rather whole grains. Reducing the amount of fat. Now, fat is a little complicated because there are several different types. There is saturated fat, which absolutely raises our risk of heart disease. Polyunsaturated fat that you may find in most vegetable oils. Monounsaturated fat, which is actually cardioprotective. This really helps to reduce your risk. And the obvious choice in that one is olive oil. It is a great tasting oil. It can be used on salads. It doesn't become rancid at room temperature, and it will help to reduce your risk of heart disease. And then there's trans fats, which we have hopefully most have heard about by now. It's something that's used primarily in snack foods, but it's a very dangerous kind of fat. It should not be part of human consumption, but it is. And then there is fish oil. Fish oil is a form of fat. By the way, the difference between oils and fats is that oils are liquid at room temperature and fats are solid at room temperature. But basically they operate the same in terms of how they react to our body, but each of them is quite different. The fish oil contains certain chemicals that we need to help reduce risk. So the positive ones would be fish oil and monounsaturated oil. Those are the two that you should be focused on. The ones you want to reduce are the saturated fat, which is primarily found in animal source protein foods and dairy. Reducing salt and sugar. The food industry is not necessarily your friend. You may think so because things taste good, but the reality is they know that we are sensitive to sugar and salt. And as a consequence, they use that to keep the food palatable, make it taste good to us, and get us hooked on sugar and salt. Both of them have some certain negative consequences. With salt, tends to raise our blood pressure. With sugar, of course, it's empty calories, and we don't need any more calories. So reducing the amount of salt and sugar makes sense in making your choices about food. And then water. You know, we are the only mammal that consumes anything other than water after weaning. The other animals don't drink tea or coffee or alcohol or pop. They drink water because that's what we're designed to drink. It is the beverage of choice. And of course, there are lots of things that are positive health consequences to staying fully hydrated. Just because I'm a guy and sometimes I am not so keen on fruits and vegetables, I thought this slide was kind of funny. But the idea is that this is what you should be consuming. Let's talk about physical activity. I just this morning saw a sign that said, if you want to stay active, be active. Point is that there is a minimum amount of physical activity that all of us require to maintain our health. And that hopefully would be met by our daily activities. But to really improve our health, to make positive changes, you probably need to raise the amount of physical activity. It also has a way of helping to diminish the effects of aging. We stay fitter, stronger, healthier, longer. So that makes physical activity a positive step. And it makes us function better. We can lift and carry and push and pull and all the other physical activities that we might want to do with greater ease. My general recommendation for physical activity is fairly simple. Do something every day. Instead of my giving you a complicated exercise prescription, I would say, go take a walk when the weather's nice. Or even if it's not, you can still go take a walk, go to a mall. When the weather appropriate, ski, swim, kayak, bicycle. I mean, there's a lot of choices, and you can mix them up, but the idea is to try to get some physical activity in every day. Worst case, gets to the end of the day and you realize you haven't done it, get on the floor. Do some calisthenics or some stretching. Anything is better than nothing. That's really the key. Now, tobacco use. Hopefully in this country it has diminished quite significantly, and for good reason. Cigarette smoking particularly is the #1 cause of preventable death in this country. That's pretty significant, especially since most of us and most of our kids have been taught since early childhood about the dangers of smoking. But we do know that still to this day, smoking is the biggest driver of healthcare costs because the consequences of smoking are so great. Everything from emphysema and heart disease and lung cancer, it is horrifying what it can do. And what I want you to do is understand, we were sold a bill of goods. We had a tobacco industry that convinced us that everybody smoked, and so those of us of a certain age pretty much all did. It was horrible, the fact that what it did to us as a nation and individually, the diseases that it caused. So they were able to convince us enough that they were putting cigarette machines in virtually every public setting. We had ashtrays on our tables when we went to a restaurant. Point is, everybody doesn't smoke. You don't need to smoke. If you're having difficulty with quitting smoking, there are lots of places where you can get help. So New York State has a quit line that will help you to go through the process. There are even medications at this point that may cut down on cravings, but cigarette smoking is a big deal and you should not be doing it. How about excessive alcohol use? Well, I feel comfortable talking about this one because I'm Irish. Okay, just trying to be funny. But the reality is there are a lot of health issues related to alcohol use. Accidents, of course. We know that whether they're automobile accidents or accidents at work, alcohol changes how you function physically and puts you at great risk. And of course, health conditions, we know that there are certain esophageal cancers, stomach cancers and so on that are related and damage to liver that are related to excessive alcohol use. There's also the psychosocial issues. If you're somebody who, when you drink alcohol, you become angry, miserable, frustrated too easily, then you don't need it. It's not good for you, and it may not be good for the people around you. What we do know is that the limits that have been established and well established in the medical community is no more than 2 drinks a day for men and 1 drink a day for women. That's the bad news. Well, that's actually some of the bad news. The other bad news is it's not cumulative. What do you mean? I mean, just because you didn't drink Monday, Tuesday, Wednesday, Thursday doesn't mean on Friday, well, I built up all this, I can, no. This is 2 drinks a day for men in any 24-hour period. So alcohol needs to be considered something that is an addictive drug. It may help us to relax. It may have some positive effects. Sometimes we sit around and enjoy each other's company. But if you're not enjoying people's company when they drink, then you know what? They shouldn't be drinking. And if you're that person, don't drink. And of course, be aware that it can have some serious health consequences. Let's talk about interacting with your doctor. Once you get involved in the healthcare community, there are some things that you should know. First of all, every member of your family needs a personal physician. Why? Well, because you want somebody who knows you, knows them as individuals. Going to the emergency room is not a way to handle your health conditions. They don't know anything about you. They're not the people who are going to be able to treat all these conditions that you're dealing with on an ongoing basis. You want somebody who knows your health history, who knows your family history, knows what medications you're on, knows how compliant you are with your preventive screenings. This is what's called a personal physician. Now, when you interact with your personal physician, first of all, you have to accept some responsibility. It's not their job to keep you healthy. That's your job. Their job is to help you to identify the things that you need to know so that you do modify your habits so that you can stay healthy. I suggest that you always should be extremely open and honest with your physician. It doesn't help if you think, well, this is too embarrassing, I can't talk about that. There is nothing that they haven't heard of before, seen before, so be honest and open with any conditions that are bothering you so that they can give you help. There will be, when you start interacting with your doctor, some poking and prodding. That's what they do. And why do they do that? Well, because they use all of their senses trying to identify abnormalities or illness. So be sensitive to that and go with it. Let them do what they need to do so they can then identify or diagnose disease conditions or help you to be more aggressive in your disease prevention programs. And the follow through, what does that mean? If they tell you to do something, do it. Because you're not going to change anything. Seeing somebody once a year or once every 6 months is not enough to significantly affect your health. You need to do the things that they give you as recommendations. Let's go a little further. If you have a health insurance that has a 24-hour medical helpline, I strongly advise that you use it. This is a place that you can call and talk to a healthcare professional, get some information virtually 24 hours a day, and it could be something that is somewhat urgent, or it could be something that is just a general question, but you're dealing with healthcare professionals who can help you to answer those questions and keep you on the road to good health. So what do we need to know? Well, there are some things that we do know about your health that can be identified as risk factors. For example, elevated blood pressure hypertension is a disease, but it also is a major contributor to strokes and heart disease. What you want to know with blood pressure, you want to know what it is, and the only way you can tell what it is by having your blood pressure measured. And they can do it perhaps in a drugstore or grocery store, but your doctor can do it, your dentist may do it. And what you're looking for is a blood pressure reading that is less than 120/80. Those represent the pressure in your vascular system, your arterial system, during a heart pushing blood out and when it's refilling. Those are the two numbers, and the idea is that you need to keep those numbers under control. Cholesterol, big deal because it's a strong relationship to the development of heart disease. We know your total cholesterol should be under 200. And then there's a bad cholesterol, the LDL. This is the one that, when it's elevated, really puts you at risk, and that should always be under 100. But there's also a good cholesterol, that's the HDL, and for men that should be greater than 40, and for women greater than 50. Those numbers are things that you can only tell through a blood test. So when you see your doctor, hopefully on your annual physical, they're doing blood work, which should help you to understand cholesterol levels. Now BMI, many of you already know what body mass index is all about. If you don't, there are charts and they're available online, they're in your doctor's office, whatever, lots of places you can do it. Your BMI establishes a relationship between your height and your weight and puts you in a category based on risk. What we would like is that you keep your BMI under 25. If you put yourself on the, look at one of these lists or charts, you'll see there's a place for your height and a place for your weight, and where those two meet gives you a number, and staying under 25 puts you at low risk. Stress. I mentioned stress because it is a big deal in terms of how we all respond to it, physically, psychologically, and emotionally. So you need to know how to manage your stress by understanding what makes you feel stressed and what you can do about it. So let's start with one of the more obvious ones. For many people, the biggest stressor in their lives is other people. Well, if that's the case, then you need to understand and really practice your interpersonal skills. What do I mean? I mean, how do you communicate with other people? How do they communicate with you? Here are some of the suggestions. Try to be assertive, but not aggressive. Telling people what you need, want, and desire is important. But telling other people what they need to do is being aggressive, and that's really not the answer here. Set boundaries so that people aren't asking you or forcing you to do things that are too much. Already, most of us are pretty busy. You don't need more things on your plate. If that's the case, set boundaries. Consider your communication style. Do you always speak to people with respect? Do you have eye contact? Do you use a good tone of voice that isn't sarcastic or condescending? You know, dealing with people on that level will help them, you and them, to understand. This one I thought was interesting in terms of communication. I am a real fanatic about people communicating. What does communication mean? Well, it means not just what you say, but what you hear. So there's two sides to it. So in some cases you have to in order to understand the facts, what's going on, what's happening in their life, what their perspective is, you need to listen, and listen attentively. It's not just a break in the conversation for you to think about what you're going to say next. It's a chance to truly understand another person, and then you have to be able to talk and explain. You've got to be clear about what it is that you need, want, and desire, what's making you uncomfortable. Saying, no, I'm not going to talk about it, doesn't help. It just doesn't help. You need to share with other people. And then there are resources that you may be able to use to help you relax from a stressful situation. Reading, listening to music, reading books, those are all things that you can do, and be careful about the choices you make about things to reduce your risk. Bad choices would be things like alcohol. Not a good choice. Doesn't solve a single thing, and it does put you at risk. Food always seems to be our friend. Why can't we just eat our stress away? Well, because it also has some negative consequences if you overdo it. So be very conscientious about the choices you make on how to reduce your stress. Then you also have to know that there are some ways that you can control your physical response. So some people are alarm responders, and they become aggressive, if you will. It's partly hormonal because the adrenaline enters the bloodstream and it makes your heart rate go up, your blood pressure go up, your muscles become tense. It is preparatory for what we call the fight or flight mechanism. That is our body ready to defend itself. Well, that's not often the case, but what is the case in many cases is that aggressiveness gets translated into road rage, fighting, whether verbal or physical, or some sort of domestic abuse, whether again, emotional, physical, or verbal, because of not being able to manage the anger that might be triggered by a stressful situation. So how do you control that? Well, there are some things. First of all, you should learn to do deep breathing. What we do know is that your body, when it's relaxed, breathes very deeply. So when you help yourself to breathe deeply, it will relax your body. Take 4 to 6 seconds to breathe in, hold it for a couple of seconds, 4 to 6 seconds to breathe out. That kind of a pattern will help you to focus on your breathing and help your body to relax. There is such a thing called progressive relaxation, where you actually tighten and then relax certain parts of your body, working perhaps all the way from your toes up to your neck, to gain control over muscles that have become tensed as a consequence of stress. There are activities like meditation and yoga that are really focused on mind-body connection and helping you to relax and gain control over some of these physical responses to stress, and exercise. Now I want to make it very clear that for those people who are regular exercisers, oftentimes the reason they do it is because it helps them to physically relax. It could be the endorphins, which is hormones that are created during exercise. It could be that during the exercise it's a chance to get out and take a walk and get some fresh air. It may be that it's a chance to just focus on yourself for a period of time. But exercise can be a great stress reducer, and it tends to reduce the hormones that trigger all the fight or flight responses. Dental care. Well, why would I go there? Well, it's because we know that dental hygiene plays a role in your general health. There are some pretty basic things. Brush and floss every day. Get a regular visit to your dentist. Have your teeth cleaned. Professional cleaning is a big deal. Avoid tobacco and alcohol as much as possible, and eat wisely to prevent tooth decay. Don't want to have you lose your teeth. Not fun. Now, there's a lot of alternatives now with implants of various kinds, but that's not where you want to go. These teeth that you were born with, well, the ones that you grew into eventually, your second set of teeth, are designed to last you a lifetime, and you can help it to do that by simply taking care of them. What about preventive screenings? Well, what am I talking about here? Well, we have a way of identifying certain of the factors that might contribute to disease. For example, for men, we want to have, once you reach a certain age, colorectal screening. And that's to identify precancerous polyps that may eventually lead to a cancerous situation. You should have your PSA measured so that you can identify as early as possible whether you're developing prostate cancer or something that might lead to prostate cancer. And of course, your blood pressure and cholesterol should be done regularly as part of your annual physical. Now, I know for a lot of people, staying compliant with medications is a difficulty, but here's the point. They only work if you take them as directed. And I don't mean directed by the guy working next to you. I mean directed by a healthcare professional. Understand the side effects, because they could be serious, and if they are the kind of side effect that you should be reporting to your doctor, I do think your best source here, besides your own doctor, is your pharmacist. I always recommend that people don't chase prices around by changing pharmacies all the time, that your pharmacist gets to know you, gets to know the medications you're using, and looks for medications that might not interact well. So there is some value in that. And before you'd ever think about skipping the medication or stopping it, talk to your physician. That's the person who can make that decision. I put this one in here because although I said cancer and heart disease were the two major killers in the United States, another one that is preventable is medical errors. You have to be in charge. You have to understand a physician, a physician's assistant, a nurse, they're medical professionals, but they can make a mistake. They can cause an error, and you need to be sensitive to that. So I would suggest what you do is ask the questions. Be sure that you are getting the information you need. It is about you, so be sure that you are in the leadership role, or get an advocate, somebody else who can be in the room and ask the right questions so that you make sure that everything that is happening in an appropriate manner. Check with your prescriptions and read all the instructions. I mentioned now, just get an advocate, somebody who can be with you and ask the right questions. And understand and ask about the current course of your treatment. How long is this going to last? What's going to be the outcome? What should I expect along the way? Am I going to get better, worse before I get better? What's the process? Understand all of that so that you can be the in-charge person when it comes to your own health. Ultimately, this is what we want. We want you to eat better and exercise more, have a positive mindset, so that you can feel good and protect your health. That's the key. The most important factor in protecting your long-term health is you. Thank you so much for listening.